name is Dr. Jim Powell, chiropractor here in Canton, Ohio.
And I'm Dr. Chip Null, also a chiropractor here in Canton.
We'd like to welcome you to Before the Scalpel. We have a unique program here at Powell Chiropractic Clinic, the only clinic in the United States with this exact program, and we have a 90% success rate.
And we call it spinal decompression therapy, also known as the Discovery Program here at Powell. Welcome.
Welcome. Welcome to episode 2, the bulging disc.
So, bulging discs. What about bulging discs?
Bulging discs are kind of like jelly donuts.
Right.
And if the jelly inside the donut starts to migrate or move, that pressure on a nerve can be substantial.
Cause significant pain.
Yep.
It's one of the most common things we see, actually.
Sure is.
Yeah.
And the unfortunate thing is a lot of doctors will say, you have a bulging disc, but why don't you take these pills? Or there's not a lot we can do.
Yeah, so and that's really treating more of the symptom as opposed to the cause. And so treating the cause is actually how we help the problem.
Correct.
And we see that a lot.
Bulging discs can happen for a wide variety of different reasons. It could be one specific direct injury. It can be repetitive injury. And a repetitive injury, what most people don't understand is if you lift something and turn repetitively over time, that actually can be an injury. So people mistake lifestyle, don't even consider it as an injury, but it is.
And also many times with a disc, a bulging disc, or even a herniated disc, you won't necessarily have back pain. The pain can oftentimes be in the leg, and it could be numbness, could be weakness, all coupled with the pain.
And the discs can bulge in the neck and end up going down the arm into the hand. Very commonly, I have patients with hand or elbow pain that's coming from their neck, but they don't have any neck pain.
So a lot of these discs that come to us, they've had images called an MRI. So it's a magnetic image that allows us to see the disc, and we can make a determination as to whether or not we are able to help them with our disc decompression.
To describe MRI, it's a very valuable tool, but if I were to take both of my arms and put it in an MRI unit and have the radiologist read the scan, he's going to talk about the bones, the ligaments, the muscle, all the tissue. But if I ask the radiologist which arm is paralyzed, he couldn't tell you the function of the arm. He can just tell you the anatomy of the arm, and those are two completely separate things.
Absolutely, and these images are really what determine if the decompression machine here at Powell can help them.
Correct. We do a lot of examination findings in addition to those scans to help us determine if that person has the right diagnosis or the right equation, recipe, to get success in our machine.
That's right. And one of those other images that we use is X-ray. We take X-rays on all patients, and that helps us determine if there are alignment issues, bones out of place or out of position, that will absolutely need treated in addition to the disc.
Right. A lot of the time, doctors will say, well, you have a bulging disc, but a lot of people have bulging discs, and as you're getting older, you're probably going to have more. Not a lot can be done, so maybe try some physical therapy or try some medication for anti-inflammatories, but there's so much more that can be done for a bulging disc.
Absolutely. In addition to the decompression and the spinal alignments, we also have a very specific strengthening program. We utilize cold laser to decrease inflammation, which will also decrease pain and help the disc heal. And then we do a lot of nutritional support as well.
And the combination is what gives this disc recovery program such monumental success. Each of those things on their own have success for patients' pain. But when you combine them all together, you even get a better result, and that's what we've found over the last 20 years.
Yep, and that just evolved along the way, and it's really been great.
Yep.
Really been great. So.
And the reason that we built this is because we've seen so many cases over the years not get the results that we know they're capable of, and by being able to use this with patients helped us refine the system.
Absolutely. And we've come to the conclusion that many patients coming here thinking surgery is the only option. It's not the only option.
And it's got to be the right patient and the right equation. So
Correct.
we do an extensive evaluation to determine if they're a case. But if you are accepted as a case in the disc recovery program,
Yeah.
there's a 90% success rate.
That's
and
right.
that is thousands and thousands of patients over the last 20 years. We can confidently say that is an accurate figure.
It's been truly phenomenal, absolutely. So finding the cause before going under the scalpel, that's our main objective.
Correct.
Yeah.
And that's the title of our podcast, is try to understand there's ways to treat this prior to surgery.
Yeah. So don't miss our next episode. The doctor said I need surgery, but something didn't sit right.
And we have an opportunity for you to hear from one of our patients.
Absolutely, yeah. One of my patients, Evelyn, and we'll let her tell her story.
I woke up with a backache every morning. My hips hurt when I walked. Couldn't bend down, pick anything up, and I couldn't stand in one place for more than a couple minutes. I had trouble getting down on the floor and playing with my grandkids, and I like to bake and cook, and I just couldn't stand there and do it anymore. I still went to the gym. I tried to go on with my daily life and do the best I could, but I went to bed early because I hurt. I couldn't sit there and watch TV like I wanted to, or my husband and I like to hike on the trails. I had to stop doing that. He's the only one that understood, I think. I came and had x-rays, and they discovered the problem was I had some scoliosis, I had a compressed disc, and my pelvis was askew, which was causing the pain in my hips. So I right away started the decompression treatments. And I also came upstairs to physical therapy to just strengthen my back and adjustments. So it was a lot at once. I had been in and out of physical therapy off and on for 10 or 20 years. And the last several years, it just wasn't helping anymore. And I wanted to get back to my normal life, and I wanted to get back hiking and doing the things I love. So my cousin told me to come here because he has a patient here. And I finally decided to do it, and I should have done it years ago because it was life-changing.
That was quite a testimony, and honestly, you know, listening to that and treating her, of course, was great. But hearing those are things that you don't realize how much of an impact it has on somebody's life. As she said, life-changing, benefiting her, and all the things that she went through over time to try to get better. 10 to 20 years of physical therapy. Not that she didn't need that, but they were missing the key component, the spine.
Right.
Right?
Right.
And so treating the disc and making that better made her hip better. She could stand it, she could cook, she could play with her grandkids. Those little things that became insurmountable for her, you know, now she had back.
Yep.
Now she had back. And her mentioning the curvature of the spine, we see that a lot. And so, you know, I know you've seen many cases like that.
Scoliosis is another big factor that we do here at Powell Chiropractic Clinic, and the sideways curve of the spine can be devastating. So having the opportunity to see changes with her pelvis and her pain, her hip pain, we very likely changed some of that scoliosis with the treatments that we're doing, which was spectacular.
Absolutely.
Something
Absolutely.
she mentions with the life-changing event. So many businesses have metrics, you know, whether it's the amount of money, whether it's the amount of services. So there's lots of things that people measure in their business. One of the key things that we measure here at this business is life-changing events.
Yes.
So we actually record these cases, and those are the metrics that we search for, is to see those changes.
Well, and I specifically remember with Evelyn, you know, one of the questions we ask is, what is the one thing that you want to be able to do that you can't do now because of the condition you're in? And I specifically remember her saying, I want to be able to play with my grandchildren.
Yep.
And be active with her grandchildren. Because young kids, they don't understand pain, and they want to know, why can't grandma play with me? And so that has a huge impact emotionally, not just physically.
Right.
Yeah, it was awesome.
And the key aspects of the disc recovery program is, like we have said a few times, is it's the combination. So the very first piece of the puzzle, if the disc itself is too small or it's bulging, we create a negative pressure on the inside of the disc by literally pulling the spine apart at a very gentle force which sucks the water of the body, the interstitial fluids, the clear fluids of the body, into the disc space. It's rehydrating the disc, adding pressure from the inside that pushes those bones apart. The hole that the nerve comes out of, the top part of the hole is made up of the bone above, the bottom part of the hole is made up of the bone below, and the disc is in between. When you separate that space, you open up that hole. You take the pressure off of that nerve, and that relieves the pain.
That's right. Well, and one important distinction you mentioned with decompression is how does it differ from traction? Because I get that question a lot.
Correct.
And with the decompression machine, it isolates a specific disc because each disc in the spine sits at just a little bit of a different angle, right?
Correct.
And so it'll isolate that angle, so just that disc gets focused decompression. Whereas in traction, although it's beneficial, it's not as specific.
Correct.
And that's where it differs.
And the traction units don't address disc.
Yeah.
It's all the muscles of the spine.
Correct.
And so they pull these muscles apart. It has value. But when they get back to gravity, those muscles return to the same shape that they were in because you didn't change the pressure. When you do decompression and you separate that spinal segment, the disc space gets water. That water pushes against the spine and increases the pressure against gravity. So when they get back, it may not be perfect the first treatment, but if you do a series of them over time, you can significantly increase the resistance or the pushback against gravity.
Yeah, and that justifies why there's multiple treatments. It's not just, I mean, it's not going to change in just one or two.
Nothing ever
Right.
goes away with one effort. You can't do one push-up and get our strong arms. It just doesn't work like that.
It goes back to that example with Pastor Bartow. Of the 21 treatments, he had 20 before the final one actually gave him the relief.
Right.
So,
And then once the pressure is returned, the strength of the spine matters so much.
most definitely. And isolating those muscles and strengthening them specifically is what we have with our rehab program here.
Yeah, the piece of equipment that we have upstairs is called MedX. And the MedX focuses on the core of the spine.
Right.
And we're going to get into this in greater detail, but the basic gist of it is that when you're walking around, you're using your legs, your buttocks, your belly. The spine muscles hold your spine together.
Correct.
So we have to isolate your leg muscles, your buttocks, and all those muscles out of the exercise equipment so that when you're doing strengthening reps, you're only doing the muscles between the spinal segments.
That's right.
And that isolation is critical for our program.
Well, and to go off that, when Evelyn mentioned that she had a lot of physical therapy elsewhere.
20 years.
20 years. And then she came here to do our physical therapy. That's the difference right there.
Correct.
Is their machines couldn't specifically isolate the spinal muscles, the multifidi.
Correct.
Interspinalis muscles, which means in between each spinal segment, to give her the true strengthening that she needed.
Right.
And it worked very well.
And then another aspect of the care is laser. So laser is a unique piece of equipment that we have here in the United States and the world. They have logs or what is researched the most. And drugs, surgical procedures, new procedures are all researched. Laser is the single greatest researched piece of equipment on the planet for the last 15 years.
Wow.
Because they can't figure out how it beneficially affects every aspect. So when you put laser on the spinal disc that you're having a problem with, it increases the healing time. So the disc that's damaged heals 2 and maybe even 3 times as fast as if they didn't have the laser. With the laser, increases the healing time.
That's right.
It makes it's a spectacular combination.
And what's so unique and I guess bizarre is you can't even feel it.
No.
It's just a red light.
Yeah, it's cold laser,
Yeah.
but it's a very specific laser.
Right. Exactly.
Arconia is the brand that we choose to use, and the frequency is 635 nanometers per second is the red, and 405 nanometers per second is the violet. And we use those 2 laser combinations is what seems to give us the greatest anti-inflammatory aspect, but also healing the disc.
Yeah. And that science is very important in this whole process. So, yeah.
Then the final piece of the puzzle is we give a nutritional program specific dosage and a specific combination. And one of the products that's in that combination, or one of the aspects, is frankincense. Its other name is boswellia. It's anti-inflammatory, but why was frankincense a gift for Jesus? So when you put frankincense in a cellular matrix or in the body, cells exchange fluids at a much more rapid state with frankincense in presence. So healing happens faster. The whole premise of what we're doing is we pull the spine apart to get the water back in. When you add frankincense to the spine, it exchanges the fluids at a better rate. So it's a really unique combination that has brought us as great a success cases as we have.
So you have the cold laser that reduces the inflammation, and then you have the nutrients that support, obviously, the healing process with that exchange of fluids.
Correct.
So it's a good combination, and we strengthen it. So that's why we reduce the pain.
Yeah, and it's quick.
Yep.
Really is.
And effective and non-surgical.
Non-surgical. Yeah. Before the Scalpel, name of our podcast.
Yes, absolutely.
So we'd like to encourage you to catch our next one.
Yeah.
The doctor said I needed surgery, but something didn't sit right. And that's the title of our next one.
Powell Chiropractic Clinic introduces Discovery, the alternative to back surgery. The advanced Discovery protocols created in 2006 by the doctors at Powell Chiropractic Clinic are healthy and effective ways to avoid surgery and relieve pain. Innovators in chiropractic care, Dr. Jim Powell and Dr. Walter Null invite you to live pain-free, drug-free. Call today for a free no-cost consultation and preliminary examination. Powell Chiropractic Clinic, located on Munson Street Northwest in Belden Village and at powellchiropractic.com.